For teens, an unhealthy relationship with social media can lead to serious physical problems, including eating disorders. Here's KOMU8's Eric Lovelace.
Today in a calorie deficit to hit
What I eat in a day,
and
diet culture, all at your fingertips.
It comes down to that self-image and seeing this ideal body that you want to have on someone else.
Katie Farr, a senior at Missouri State, struggled with an eating disorder in high school, but she says what you see on social media doesn't tell the full story.
But we don't see that. We see a 2D image of something that we want when that could have been edited.
Farr says she struggled internally for years.
Everything went dark, and I had fainted in the back of church.
Farr didn't know it yet, but she was battling one of the deadliest mental disorders.
I'm hurting myself. Like, this is essentially a form of self-harm. I just broke down, and I hadn't told anyone.
According to the National Eating Disorders Association, every 52 minutes, one person dies as a direct consequence of an eating disorder. 22% of children and adolescents worldwide show disordered eating patterns, which is a precursor to a full diagnosis. The association also says eating disorders are the deadliest of the mental health conditions among children and adolescents, and second overall in adults. Farr didn't receive any formal treatment, but if she did, Dr. Tosh calls it the tripod of care. First leg, a physician, a dietitian, and lastly, a behavioral specialist like a therapist, all to treat one patient.
And certainly social media, unrealistic expectations for body image, oftentimes perpetuated by social media, certainly can contribute to why an eating disorder could start.
Dr. Anish Tosh works at MU Health and specializes in adolescent eating disorders. He says if a teen shows these symptoms, they should consider seeking care.
All of a sudden changing their eating behaviors, having negative body image because of that, making negative comments about their own appearance.
And having parents involved is key to treatment.
They don't necessarily want to get better. They don't necessarily want to get help. So very much we have to train the parents to kind of relearn what normal eating looks like.
Kelsey Esser works at The Current in Columbia. The Current doubles as two legs of the tripod of care, with both therapists and dietitians on staff. And she says the culture of social media can be very dangerous to those prone to developing an eating disorder.
It's really just so triggering to somebody who is in an eating disorder to be receiving continuous messages about weight loss or comparing themselves to, their peers on social media.
Esser says social media alone doesn't cause an eating disorder, but they do enable them. And she says a routine part of treatment is turning your phone off.
So often we're taking social media breaks.
And Farr has a message for those struggling, either out loud or in silence.
There's no flaw. There's nothing wrong with you. But there's also people who are going through the same thing you are, that you are okay the way you are.
Eric Lovelace, KOMU8 News, Columbia.
There are resources, outlets, and recommendations for teenagers and beyond, plus family members and loved ones, to help practice and guide people toward healthy social media use. You can connect with these resources on our website, KOMU.com.